Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Today's topic, home medical equipment. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, James.
And with us in the studio on Health Talk, Pam Kaler, Executive Director of Mon Healthcare Equipment and Supplies. Welcome, Pam.
Good morning.
And I think just about all of us, no matter what our age, at some point need some kind of medical equipment at home, whether it be crutches, canes, walkers, all those types of things, right?
Absolutely. For some people, Jim, it is a short-term or a temporary situation or temporary need, and for other people it may be chronic, it may be for the rest of their lives. But we serve people at all ages and all stages of life, and the need is really great and growing.
And so do they not sell wheelchairs at the big box stores now or home medical supplies at the big box stores? What is the advantage of going to the Mon Healthcare Equipment and Supplies?
Well, there are a number of differences. One of them, of course, is that we have the special credentials and the capacity to be able to bill a variety of different medical insurers. And the fact is that most people who need this kind of product, it's a medical necessity. It's based on a physician order. It's meant to meet a medical need. And so it is very often something that is covered by insurance. And typically big box type of stores are not billing insurance on your behalf.
And also, you don't want the guy working in the hunting and fishing department coming over and trying to determine what kind of oxygen you need.
Yes, that would probably not be the best place to get that kind of advice. And the truth of the matter is that most people, including me, before I became professionally involved in the medical equipment and supply field, don't know that there really isn't just one kind of a particular product. In fact, with wheelchairs, there are just innumerable sizes, styles. There are different types of modifications that are made to wheelchairs. I mean, just with wheelchairs alone, there's probably 500 different kinds. That's not something you'd find at a big box store. There are firms like ours that specialize in that.
Can you rent it or do you have to purchase it?
It's either or.
Okay.
Many products actually can be rented. If they're durable enough to be rented and they can be disinfected between customers, then yes, they can be rented. But some items, of course, would not be appropriate for that kind of treatment. Mm-hmm. The determination about something, whether something is for rent or for purchase, very often, Kay, is made by the insurer, the party that's paying for it, because their contract may determine how we are expected to handle the transaction.
Now, you don't cover just Montague County. You have several counties that you cover.
We do. We cover a large part of north central West Virginia. And that isn't something that's well known to the community because oftentimes folks in the community relate to us as the store on the corner that is next to Dairy Mart and across from Health South. And so
you just answered my next question. Where are you located?
Yeah. It's like a showroom over there.
Exactly. And so oftentimes the public relates to us as if we are only a retail type of a business. But the fact is that about 96% of what we do is on the basis of a medical referral, somebody, a patient, a physician, a social worker, a nurse, a clinic, contacting us to provide care to a patient where we have it delivered all across the state in some cases. But we primarily serve Mon, Marion, Harrison, Tyler, Wetzel, Preston, those counties that surround this studio.
Do you sell prosthetics?
Yes, we do. Not all sorts of prosthetics, but the area where we, Jim, really specialize is mastectomy prosthetics. And you both, I'm sure, are very aware, and the listening audience is aware, that there's a real focus on the prevention and treatment of breast cancer. And we are part of that continuum of care for women who choose not to necessarily have reconstructive surgery. If they or their doctor believes that it's best for them to have a breast replacement in the form of a prosthetic, we are absolutely the specialists in that area for that kind of a fitting.
I did a live broadcast there one time.
At Mon Healthcare?
Yeah, in the showroom.
That must have been before my time.
It was before your time. I would have remembered you.
Oh my.
Yeah, it was before your time, but I was glad that they invited me over because we drive by it all the time.
Yes.
And like you said, it's right next to the Dairy Mart on Van Voorst Road.
Yes.
I don't know if it's a Dairy Mart, maybe Circle K now, or I'm not even sure. But it's right there near a very busy intersection. We drive by all the time, but probably a lot of us haven't stopped in until we need you.
Exactly.
And it's usually by referral. Probably our doctor says go over there and, for instance, diabetic supplies. What kind of diabetic supplies do you have in there?
Well, I'll tell you, we do all kinds of different things for folks who have diabetes. Probably one of the most popular in the recent past is diabetic shoes. We provide shoes to care for the vulnerable feet of diabetics. Those require specialty fitting by someone who is certified to do that kind of service. Another area where we help folks with diabetes is providing insulin pumps and the supplies that go with them. And as you probably can tell, what we try to do is focus on the items that not necessarily are available readily in, say, a drugstore. Mm-hmm. We provide, of course, glucose monitors and glucose strips and those sorts of things. And we also provide some of the socks that people can wear that have kind of special wicking properties that make it less likely that a diabetic would be subject to infection on their feet.
Do you have compression stockings over there?
Oh, I'll tell you what, sometimes I wonder if anybody is swelling in this area because we provide so many compression stockings. I wonder who in the world could be swelling in their legs anymore. Yeah. But they are, because people who have swelling, they have edema, they have varicose veins, or they're predisposed to varicose veins, even people who are on their feet a lot and just want to avoid discomfort. Compression stockings is one of our most popular product lines. Some of those are available with a prescription and some without. We're doing fittings for those all day long and practically twice on Sunday.
Wonder how much insurance covers the cost of diabetic shoes and compression stockings and those types of things?
I would say, generally speaking, it is overwhelmingly, to some extent, a covered benefit by most insurers. Not all, but most. And insurers often have quantity limitations. For example, you may only be able to get 3 or 5 pairs a year. So it's not an unlimited benefit, but most medical insurance has some provision for those products, Jim.
For it to be covered under the insurance, do you have to actually have a prescription when I walk into your establishment?
That would be the minimum requirement, Kay, yes.
So you should have a prescription. But can I come in otherwise if I have a homebound person that needs a bed or something? Can I come in as an individual and just walk in?
Absolutely. If it's something that a medical insurer, if you desire that we bill a medical insurer, then a prescription really would be the very minimum requirement. And most medical insurers, particularly Medicare, require far more than that. But most items that we carry, if you choose to pay cash and not have a medical insurer involved, don't require a prescription.
Our guest today is Pam Kaler. She's the Executive Director of Mon Healthcare Equipment and Supplies. And while you're listening to us here on Health Talk, you can also visit their website at monhealthcare.com. We'll be back to Health Talk on WHAR right after this.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Pam Kaler, Executive Director of Mon Healthcare Equipment and Supplies, which is an affiliate of Mon General Hospital. Mon General brings you this program, Health Talk, and I bet most of us have a son or a daughter or somebody that needed crutches. And they try to ask family members, hey, you got any crutches left over from that time you hurt your leg? And they're never the right size, and the rubber thing's missing off the bottom of them. But you'll probably get crutches over at your place, right?
Oh, absolutely. Crutches and quad canes, and it's amazing how many walkers we provide. Walkers with baskets, walkers with wheels, walkers with seats. You know, when it really comes down to it, I don't know, Jim, that people really want the sort of product that we provide, to be honest with you. What they want, however, is the benefit that it brings them. Do they want a pair of crutches or a walker? Probably not. Who would? But what they want is the ability to move, the ability to be able to go where they need to go and have freedom and independence and not have to necessarily depend on someone else to be able to get from point A to point B or to enjoy a stroll at the mall. So the kind of products that we provide, including ambulatory devices, are really designed to give people safety, security, freedom, and independence, because those are the things people really seek when they want to improve their health status at home.
And those types of things are adjustable, the walkers and the crutches and those things. And I would imagine that at your place you'll take care of us, make sure the right size, make sure they're just perfect for us to get the best out of it that we can.
Absolutely. And that, again, is something I think that separates our type of company from a big box store. You know, one of the most important things, particularly with products that you sit on, like bath seats, or lean on, like crutches, is to make sure it has an appropriate weight capacity for you or your loved one or your family member. Very often people don't think to ask that question. How much weight can this safely support? We make sure, our staff makes sure to really look at all of those things so that what you receive from us is safe and appropriate for your particular need and your body type or whatever may be the case.
Let's say you deliver some of the larger items and we're not familiar with them, and do you just send out a delivery person to drop it off, or do you send someone also that can explain the product and how it works?
Great question. That is something that is one of the cornerstones of our kind of company and our kind of business, is that we have very specially trained personnel that are able to not only go into a home and effectively and quickly set up medical equipment like hospital beds that are highly adjustable, or place and train and teach on oxygen or those kinds of products. But they're able to make sure that when it goes into the home, that the patient, the family, any caregivers are absolutely comfortable with it. They know what to do, how to care for it. They can do some basic troubleshooting so that they can feel comfortable with what's in their home. And we also do what I would call a home assessment when we deliver wheelchairs or any other type of product, to make sure that we're pointing out things like electrical risks, making sure sockets are proper if something is being plugged in, making sure that throw rugs are appropriately placed or removed.
Yeah, things we
do
think
those
about.
Right. We do those sorts of things pursuant to our delivery of the equipment, but also just to hopefully up the general safety in the home for everybody that's using it.
If it hurts us too much to go up and down the stairs now, and you have stair lifts.
We do.
Which is something that needs to be installed and perhaps maintained over time, or maybe something goes wrong with the stair lift.
Exactly.
And you provide support after the sale and installation?
We absolutely do. And we really pride ourselves on that, and hope that that folks out in the community are able to note that difference about us. When we get involved with providing any product to anybody, we really feel that we're developing a connection with them for a lifetime if need be. Stair lifts are an absolutely wonderful product. So many people here in West Virginia, they're in a home for a long time, and even though their physical capacity changes, they don't want to move, or perhaps they're not in a position to be able to move. So they want to adapt their home so that they can use it and enjoy it safely. And stair lifts are one of the items that makes that possible. We can do straight rail stair lifts. We can do stair lifts that curve and go around. Pretty amazing. And if people need continuing service or new batteries or some troubleshooting, we're here to help.
When I was a little bitty kid visiting my grandma on her farm in Tennessee, I used to love her lift chair. I thought it was like a toy to me, but she needed it because she liked sitting in that recliner, but it was hard for her on her legs to stand up out of the recliner. And you have those over there too, don't you? We do.
That actually has become one of the most popular products. People who have disorders or deterioration of hips and knees, particularly the hips, where they're in a chair and they really have trouble getting out, find power lift recliners to be just a lifesaver. In In fact, we know that some people not only sit in them for a good bit of time, but some folks sleep in them. So people want them to be comfortable, they want them to fit their body, they want them to be good looking, made of a durable fabric with foam on the inside that doesn't deteriorate and has a really reliable lift mechanism that is suitable for their weight. So we carry a great selection of lift chairs at all price points, and that's one of those products that's fun to provide to a customer because they're so happy to get it.
I can't think of a thing that they don't have.
What
you know,
yeah.
I was thinking about a list here, and I was going to say, give us a list of what you carry. It would be impossible.
It would be impossible, I think. At one time in the past, I know that we used to be asked by folks to provide a catalog, and it was very difficult to provide a catalog because I think our inventory numbers in the thousands.
I'm sure.
And covers, as just we've talked about in this short time today, points all over the map regarding product. Yeah, I would call us pretty diverse. We're very proud of that because we want to make as much as possible available right here in North Central West Virginia. You know, this is a community with wonderful medical resources, specialties and subspecialties. We really, frankly, don't want people to have to shop on the internet or go all the way to Pittsburgh to get something if we can make it available right here. And that's part of our mission.
I bet I can guess a top seller.
Go ahead, Jimmy.
CPAP.
CPAP is definitely a top seller. And for those listeners who may not be familiar, those devices are for the treatment of sleep apnea. And obstructive sleep apnea is something I think that you may have talked about before on this morning program. And one of the most common therapies for sleep apnea is CPAP, which stands for Continuous Positive Airway Pressure. And it's basically just blowing a flow of controlled air through your nostrils in order to be able to keep your airway open. And the technology in CPAP is incredible. It's quiet, it's effective, it's easy to adapt to. It incorporates humidified air. We provide lots of CPAP, and about 94% of all of our patients are not only satisfied but highly compliant, and the national average for that is about 70%, Jim.
One more thing I want to ask you about before we take the break. What is Lifeline?
Lifeline is a very well-known, probably one of the best personal emergency response systems that is on the market, and it has been for a long time. It is one of those items that people know if a person is perhaps living alone or a little bit frail and worries about something happening where there's nobody able to help them. They can wear a pendant bracelet or they can wear a pendant necklace, press a button if they're scared or nervous or have symptoms that worry them, and then immediately they will be contacted by Lifeline. Their caregivers can be called in a particular order. 911 can be called, and it's very customizable. It's a really amazing product, but what I think makes Lifeline really incredible is that it has a feature in it. There's a pendant that a patient can choose or a person can choose to get that would self-detect if they fall. So if they're not able to press the button, this unit detects on its own that a fall has occurred and will start making those calls for them. And very soon, and you are probably the first to know about this, Lifeline from Mon Healthcare will be available and be able to be used wirelessly, both inside and outside the home. Which is pretty neat.
Now, will Medicare cover that?
They will not.
Okay.
I sure wish they did.
Yes,
we provide lots more of them, but that is not something in the Medicare benefit, unfortunately.
You're listening to Health Talk on WAJR, brought to you by Mon General. Back after this.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Finishing up our conversation with Pam Kaler, Executive Director of Mon Healthcare Equipment and Supply. So do you recommend we just stop by and browse?
Absolutely. I can tell you that the retail location that we talked about It's at 1159 Van Voris Road, and as you'd said earlier, it's next to the Dairy Mart and across from Health South, which are some of the landmarks that people seem to know pretty well around here. We are open Monday through Friday from 8:30 until 5. We are able to work in the evening by appointment, and Saturday 9:30 to 1.
All right, and plenty of parking right at the door.
Absolutely.
Thank you, Pam.
You're welcome.
Stay tuned for Morgantown AM coming up on WHAR.